Understanding lymphoma, Hodgkin's versus non-Hodgkin's, symptoms and treatment on Health Sphere. Welcome back to Health Sphere. Today, we're tackling lymphoma, a type of cancer that originates in the lymphatic system. The lymphatic system is a vital part of your immune system, a network of vessels, nodes, and organs that helps protect your body from infection and disease. When lymphocytes, a type of white blood cell within the lymphatic system, grow and multiply uncontrollably, they can form tumors and impair the immune system's function. Lymphoma is not a single disease, but rather a group of cancers. The two main categories are Hodgkin's lymphoma and non-Hodgkin's lymphoma. While both affect the lymphatic system, they differ in specific ways that impact diagnosis, treatment, and prognosis. The two main types, Hodgkin's versus non-Hodgkin's lymphoma. The key difference between Hodgkin's lymphoma and non-Hodgkin's lymphoma lies in the specific appearance of the cancerous cells under a microscope. Hodgkin's lymphoma. The defining characteristic of Hodgkin's lymphoma is the presence of a specific type of abnormal cell called the Reed-Sternberg cell. These are large abnormal lymphocytes with multiple nuclei, often described as looking like owl's eyes. When a biopsy of cancerous lymph node tissue reveals these cells, the lymphoma is classified as Hodgkin's. HL typically starts in lymph nodes in the upper body, such as the neck, chest, or armpits, and tends to spread in a relatively orderly manner from one lymph node group to the next. Hodgkin's lymphoma is less common than non-Hodgkin's lymphoma and is often highly curable, especially in its early stages. It has a bimodal age distribution, meaning it is most common in two age groups, young adults and older adults. Non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma is a much more diverse group of lymphomas that do not have Reed-Sternberg cells. NHL can arise in lymph nodes anywhere in the body as well as in other organs. Unlike HL, NHL can spread in a less predictable pattern. Non-Hodgkin's lymphoma is significantly more common than Hodgkin's lymphoma, accounting for the majority of lymphoma cases. NHL is further classified into many different subtypes based on the specific type of lymphocyte affected and how quickly the cancer is growing. NHL is generally more common in older adults, although some subtypes can affect younger individuals. The precise diagnosis, including determining whether it's HL or NHL, and identifying the specific subtype of NHL, is crucial because it dictates the appropriate treatment plan. This diagnosis is made through a biopsy of affected tissue, usually a lymph node. Recognizing the signs. Common symptoms of lymphoma. Both Hodgkin's and non-Hodgkin's lymphoma can cause similar symptoms, although the presentation can vary depending on the type and location of the lymphoma. It's important to be aware of these potential signs and consult a doctor if you experience any persistent or concerning symptoms. Keep in mind that many of these symptoms can also be caused by other, less serious conditions, but it's essential to get them checked out to determine the cause. Common symptoms of lymphoma include painless swelling of lymph nodes. This is often the most noticeable symptom. Lymph nodes may feel enlarged in the neck, armpit, groin, or other areas. Unlike swollen lymph nodes due to infection, which are often tender and may subside as the infection clears, cancerous lymph nodes are typically painless and persistent. Fever, unexplained fever that may come and go. Drenching night sweats, severe sweating during the night that may soak clothing and bedding. Unexplained weight loss. Losing 10% or more of body weight over 6 months without trying. Fatigue. Persistent, extreme tiredness that doesn't improve with rest. Itching. Generalized or localized itching of the skin without a rash. Coughing, shortness of breath, or chest pain. If the lymphoma affects lymph nodes in the chest, it can press on the airway or lungs, abdominal swelling or discomfort. If lymphoma affects lymph nodes in the abdomen or causes the spleen or liver to enlarge, it can lead to a feeling of fullness, bloating, or pain. It's increased susceptibility to infections due to the impaired function of the immune system. Easy bruising or bleeding. Less common, but can occur if lymphoma affects the bone marrow and impacts platelet production. The combination of unexplained fever, drenching night sweats, and significant weight loss is sometimes referred to as B symptoms. The presence of B symptoms can be a factor in the staging of lymphoma and influences treatment decisions. It's crucial to reiterate that experiencing one or more of these symptoms does not automatically mean you have lymphoma. However, If you have persistent or concerning symptoms, particularly unexplained swollen lymph nodes or B symptoms, you should seek medical attention promptly for a proper diagnosis. Navigating treatment approaches for lymphoma. Lymphoma treatment is highly individualized and depends on the specific type and subtype of lymphoma, the stage of the disease, the patient's age and overall health, and their preferences. Treatment goals can range from curing the cancer to controlling the disease and managing symptoms to maintain a good quality of life, especially for some indolent forms of NHL. Treatment plans are developed by a multidisciplinary team of specialists, which may include oncologists, hematologists, radiation oncologists, and others. Here are the main treatment approaches used for lymphoma. Chemotherapy. This is a cornerstone of lymphoma treatment, particularly for aggressive types. Chemotherapy uses powerful drugs to kill cancer cells or stop them from dividing. These drugs can be given intravenously or orally. Chemotherapy is often given in cycles, with periods of treatment followed by periods of rest. Regimens often involve a combination of several different chemotherapy drugs. While effective, chemotherapy can cause side effects by affecting healthy, rapidly dividing cells, such as hair loss, nausea, vomiting, fatigue, increased risk of infection, and low blood counts. Radiation therapy. This treatment uses high-energy rays to kill cancer cells and shrink tumors. Radiation therapy is often used for lymphoma that is localized to a specific area or group of lymph nodes, particularly in earlier stages of Hodgkin's lymphoma and some subtypes of non-Hodgkin's lymphoma. It can also be used to relieve symptoms caused by lymphoma that has spread to other parts of the body. Radiation therapy is typically delivered from a machine outside the body. Side effects depend on the area being treated but can include skin irritation, fatigue, and localized effects on organs within the treatment field. Immunotherapy. This is a revolutionary type of treatment that harnesses the power of the patient's own immune system to fight cancer. Monoclonal antibodies. These lab-made antibodies are designed to attach to specific proteins on the surface of lymphoma cells, marking them for destruction by the immune system or directly interfering with their growth signals. An example is rituximab, commonly used for BSL lymphomas. Immune checkpoint inhibitors. These drugs block proteins that cancer cells use to evade detection and attack by the immune system, essentially releasing the brakes on the immune response against cancer. Checkpoint inhibitors are used in certain types of lymphoma, particularly some relapsed or refractory Hodgkin's lymphoma cases. CAR T-cell therapy. This is an advanced form of immunotherapy where a patient's own T-cells are collected, genetically modified in a lab to recognize and attack lymphoma cells, multiplied, and then infused back into the patient. CAR T-cell therapy is used for certain types of aggressive B-cell NHL that have not responded to other treatments or have relapsed. Targeted therapy. These drugs specifically target molecular abnormalities or pathways within cancer cells that are essential for their growth and survival. Unlike traditional chemotherapy, targeted therapies are designed to be more precise, causing less harm to healthy cells. Targeted therapies are used for certain subtypes of lymphoma that have specific genetic mutations or protein expressions that can be targeted. Examples include BTK inhibitors or PI3K inhibitors for certain types of NHL. Stem cell transplant. This intensive treatment is typically used for patients with aggressive lymphomas that have relapsed or are not responding to initial treatment, or for some high-risk cases up front. It allows for the delivery of very high doses of chemotherapy to kill the cancer cells, which also destroys the bone marrow. The patient's blood-forming stem cells are then replaced with healthy stem cells. Autologous stem cell transplant. The patient's own stem cells are collected before high-dose treatment and then returned to them. Allogeneic stem cell transplant. Stem cells are used from a donor. This also offers a graft versus lymphoma effect, where the new immune cells from the donor can help kill remaining cancer cells. Allogeneic transplants carry higher risks, but can be necessary in certain situations. Watchful waiting. For some slow-growing types of non-Hodgkin's lymphoma that are not causing symptoms, the doctor may recommend watchful waiting. This involves closely monitoring the patient's condition without immediate treatment. Treatment is initiated if the lymphoma starts to grow or cause symptoms. The choice of treatment depends on the specific lymphoma type and stage. For example, early-stage Hodgkin's lymphoma is often treated with a combination of chemotherapy and radiation therapy. while more advanced HL and aggressive NHL typically require more intensive chemotherapy regimens, potentially followed by a stem cell transplant. Indolent NHL may be managed with watchful waiting, targeted therapy, or less intensive chemotherapy. Living with lymphoma. A lymphoma diagnosis and treatment can be a challenging journey. Managing treatment side effects, coping with fatigue, and addressing emotional and psychological needs are important aspects of care. Supportive care, including managing infections, maintaining nutrition, and psychological support, is integrated into the treatment plan. Many resources and support groups are available for patients and their families. Conclusion: lymphoma is a complex group of blood cancers. It's distinguished primarily by the presence or absence of Reed-Sternberg cells. Recognizing the common symptoms, such as painless swollen lymph nodes and B symptoms, is crucial for early detection. Significant advancements in chemotherapy, radiation therapy, immunotherapy, targeted therapies, and stem cell transplantation have dramatically improved outcomes for many patients with lymphoma. Treatment is highly personalized, offering hope and the potential for cure or long-term control of the disease. Understanding your specific type of lymphoma and discussing all treatment options and potential side effects with your healthcare team are the most important steps in navigating this journey. Thank you for joining us on HealthSphere. Stay informed, be vigilant about your health, and seek professional medical advice when needed. This video provides general information and is not a substitute for professional medical advice. Always consult with your doctor for diagnosis, treatment, and personalized recommendations regarding your health situation.